In my public advocacy and wherever I traveled or asked to speak, I was talking to just innumerable vaccine injured. As a curious clinician, and I like challenges, I decided to take on this disease. And I've now spent 3.5 years treating patients who are chronically ill from the vaccine. When I use the term post-vaccine injury syndrome, that is a constellation of symptoms. And although we know this syndrome called long COVID, and we're only beginning to recognize long vax, I will tell you that is what my practice specializes in. What we're seeing is an epidemic of a disease that has long been called myalgic encephalitis / chronic fatigue syndrome. And the Mayo Clinic called that out in 2021 in regards to COVID, that they were seeing unprecedented rates of ME/CFS. Historically, ME/CFS has always been associated with infections. And here's what I want to tell you, that in my practice, we treat long COVID and long vax. 70% of the patients in my practice became ill after the vaccine. They are long vax. The vast majority of what this rest of science in this country is calling long COVID is actually long vax. And how do I know the difference? Very easy. It's called temporal association. If someone's symptoms present within days to weeks of COVID, long COVID. If it presents within days to weeks or sometimes minutes to hours of the vaccine, it's long vax. It's not that complicated to know what the trigger was. And they both share pathogenic insults, which is this spike protein. And the sadness, and I'll try to wrap up because I don't want to go too long, but the sadness is, in my first year in practice, I think the value that I brought to the patients is I listened to them. They understood that I understood them. I wasn't gaslighting them. I knew what was wrong with them, or I knew what caused their illness, and I was willing to try to treat it. When you take their history prior to their illness, they will report that they ate well. They were absolutely successful in their careers. They liked to exercise and stay fit. They were raising their children. And now they found themselves barely able to get out of bed in some cases. Or if they do, they immediately get fatigued and they're back in their house, and a lot of them are housebound. They cannot work anymore. They become financially unhealthy. So the amount of the ways in which they get sick is immeasurable. It's not only physical, it's financial, it's sexual, like with their relationships, it's occupational, they can't work. And so I see these multiply disabled patients who are really enjoying like the peak of their lives and now are decimated.